In the previous episode, we discussed the prevalence of ED around the world. Today, we will open the first door to treatment, which is to understand the causes, and from it, we will be able to overcome this problem and treat it. The most important thing that we always emphasize is that erectile dysfunction is a disease and there is a cure for it. But if we consider it a problem and it has no cure and it is not permissible to go to a doctor, it will grow and its consequences will grow. In addition, the psychological state is one of the most important factors affecting whether on erectile dysfunction or in its treatment. And today we will know the most important causes of erectile dysfunction and how to treat it. Stay tuned. As for the causes that lead to erectile dysfunction, they are very many. It is enough for us to know that any factor that affects one of the components of the sexual response can lead to erectile dysfunction. For example, a stressful lifestyle and continuous psychological pressure, as well as chronic diseases such as high blood pressure and diabetes. Many of the medications we use can have a negative impact on erectile dysfunction, such as blood pressure and heart medications, antidepressants, cancer, epilepsy, and hormones. Let's know the causes more so that we know what the treatment will be like. We will first talk about chronic diseases and their relationship with erectile dysfunction. First thing we'll talk about is heart and blood pressure diseases. In 2018, a scientific review was published on the relationship between heart disease and erectile dysfunction. It showed that the incidence of erectile dysfunction among patients with cardiovascular disease is high for both organic and psychological reasons. It also showed that any patient who complains of erectile dysfunction must exclude the presence of heart and vascular diseases, and it is possible that erectile dysfunction or erectile dysfunction is an indicator of future heart problems, which is what we have been talking about for years, how ED can be a sign of many diseases. A second study clarified the relationship between diabetes and erectile dysfunction, proving that erectile dysfunction is common among diabetic patients, and the latest statistics from the World Health Organization show that more than half of diabetic patients suffer from erectile dysfunction. The study also found that men with diabetes develop ED at a younger age than men without diabetes. A study was conducted in Ethiopia to determine the prevalence of erectile dysfunction, ED, in men with diabetes. The study included 462 men with diabetes who visited 3 hospitals between February 20th and April 15th, 2020. The results of the study showed that approximately 2/3 of men with diabetes have ED. This means that 2 out of every 3 men with diabetes have ED. The study also showed that age, lack of exercise, diabetes complications, and poor diabetes control and treatment are all risk factors for ED in men with diabetes. A scientific review published in 2017 discussed the relationship between erectile dysfunction, ED, and kidney disease. The study found that kidney failure can affect testosterone levels in the body, which can lead to decreased sexual desire and function, as well as reproductive problems. In 2016, a cross-sectional study of 95 patients in Istanbul was published to investigate the relationship between ED and cardiometabolic index, CMI, a measure of risk for cardiovascular disease. The study proved that the cardiometabolic index increases in patients with erectile dysfunction, and it also showed that the percentage of fat or triglycerides and waist circumference, also known as waist circumference, are higher in patients with erectile dysfunction than others. A scientific review published in 2015 discussed the relationship between pelvic floor muscles, PFMs, and erectile dysfunction, ED. The review found that many studies have shown the effect of PFMs on sexual orgasm. It also found the importance of PFM training and exercise to increase penile rigidity during intercourse. As for the effectiveness of psychological therapy in treating erectile dysfunction, this question was puzzling to researchers, especially after the dominance of Viagra and its widespread use. A scientific review was conducted in 2013 and published in the most important scientific journals concerned with male diseases, which is the Journal of Sexual Medicine. The review included more than 220 articles published in the most important research sites such as Medline and PubMed. The review answered many questions and provided more information and facts. The most important findings of the review were as follows. First, regarding Viagra and its impact on psychotherapy. Despite the success of Viagra among the public and its widespread use in treating erectile dysfunction, sexual therapists are not satisfied with it. Doctors see that they are trapped in using certain drugs instead of following a correct protocol and treatment approach. The review also included a study that indicates that the use of Viagra and similar drugs is effective in the short term, but the efficiency of these drugs decreases in the long term. Also, many studies have shown that the rate of discontinuation of drug treatment is high. The review showed us a new term, which is the biopsychosocial model. It is a treatment model that focuses on the 3 three aspects that are related to erectile dysfunction: the biological, psychological, and social aspects. The image that will appear in front of you now clarifies these aspects. The review showed that implementing an integrated model for treating erectile dysfunction, or what is known as the biopsychosocial model, faces many challenges, the most important of which are the lack of financial resources and the weakness or lack of training of doctors on this model. Some integrated models have emerged that have achieved the biopsychosocial model. Since we at Darzocora Center are always keen on development and keeping pace with the scientific and research process, we have been keen to implement the scientific model known as the biopsychosocial model at Dar Al-Zocora. We have provided specialized treatments because treating erectile dysfunction will not be a one-time visit to a single doctor or taking a particular capsule that solves all your problems. It is a treatment that involves different specialties and consultations from specialists in every field related to the disease. This is what Dar Al-Zocora Center provides. We will find a nutrition clinic, a diabetes clinic, a cardiovascular clinic, a physiotherapy clinic, a psychological clinic, and a plastic surgery clinic. This is because the patient must be treated from all aspects. It is not possible for me as a urology doctor to treat a patient with erectile dysfunction without regulating his cigar, without being assured of the condition of his heart, without dealing with him psychologically with his psychological problems, and without regulating a comprehensive diet. This is what is meant by the biopsychosocial model. We, by the grace of God, are considered one of the first places in the Middle East to implement this model to treat erectile dysfunction.